My topic today is going to be modern learning strategies. I think it fits in very well with the three presentations that we've had in the morning. I'm going to talk about reflections and how it incorporates modern learning strategies and what sort of things are embedded in reflections. So I think this is quite a big picture that we gathered yesterday with regards to how nurses have become kind of pioneers in healthcare education and healthcare. And with COVID coming into about, we've got like very complicated healthcare needs of clients. And it's like a very the current healthcare contexts are filled with complexity with regards to technological innovations and complicated healthcare needs of clients, demanding workloads with regards to COVID and work shifts, and the sometimes conflicting interests and conflicting evidences that we have got, and politically complex and politically demanding contexts and very complicated settings with regards to hospitals, and ethical governance issues. So not all of these are incorporated into the current health system. So reflection, on the other side, can be helped to navigate this complexity. So reflection, which is quite something new to the Sri Lankan context and to some other countries as well, is something that helps us navigate with complexity in the healthcare system nowadays. So now, this picture is from yesterday's presentation as well, where a nurse is demanded a lot of work, but reflections can be something that might be used to kind of make it easier on them, at least a bit. So the thing that we have identified is with education, we can have a way forward with this. So with the dynamic healthcare world and increased demands on nurses, call for a parallel shift in nursing education. That is something that we have to have a paradigm shift in nursing education, and which is, I think, IIHS is kind of the pioneers in nursing education when it comes to reflections as well. So I think Dr. Kitsiri Singh in his presentation mentioned about co-curricular activities and curricular activities where we create smart people versus intelligent people. So intelligent people might be who have all the curricular work, all the knowledge, all the things that the theory-based systems tell you. But a smart person would reflect, and smart person would have all the co-curricular activities that a person would need. So that's the balance between an intelligent and a smart person. So this is what reflection and some of the things that we talked in the morning incorporates a good learner and a good student or a good healthcare professional. So coming on to reflection now, I'm sure every one of you have baked a cake in one of the days, and the first day we might have burnt the cake. So if we burn the cake on the first day, will we do the same mistake? Sometimes if you're not a learner, and sometimes if you're not reflecting, you might burn the cake the second or the next day as well. But if you are reflecting, you won't burn the cake. You go back and see what went wrong. Have I increased the temperature? Have I not used the right ingredients? Have I done a wrong recipe? So if we burn the cake the second day, we are not reflective thinkers. So just a quick example without incorporating it in nursing as well. So if we do proper reflections, we can burn a nice cake. So that is what we all invite all of you, including the learners and the educators, to do, to reflect and to have a nice cake. So with regards to the history of reflective practice actually dates back to where Buddhist Jataka Katha, or where the Buddhist learning was happening, where Lord Buddha explains and reflects 550 life stories, where Lord Buddha described, logically explained, analyzed, and given conclusion on his life events and reflecting on these. So now if you date back the education part of it, that means education has been there and teaching has been there successfully for the last few years. So it's all about the techniques of learning and the techniques of teaching rather than incorporating all the other things. So reflection has been there from all these time. It's about incorporating these techniques into our learning and into our teaching. So, and this particular picture is very, very common within reflection literature. So this is the head picture of god Janus, where this picture reflects the god looking back and then looking forward. So this is what reflection is all about in any context, where you have one phase looking backwards of what has happened, and you're going to reflect on the things that have happened, and you're going to create a future and looking forward. So again, I invite all of you to have two phases where you look back at your past and create your future. So that is what reflection is all about. So reflection is just not thinking. So I just wanted to include this picture where we have become very massive thinkers, and we think reflection is always about thinking. But reflection is not just thinking, where we just spend hours and hours of thinking, but it has become a learning experience, and it has become a unique thing that we do to make sure that our practices are in order. So when it comes to reflection in education, something that I really want to illustrate is that it has two aspects. It should be done by the learner and the educator. So if you're an educator and you teach the same thing over and over again to the students, and the students are failing, the students aren't the ones who are failing. You're the one who's failing because you've not incorporated the right learning techniques to the students. At the same time, if the students are failing, the students should reflect and say, why have I failed? What sort of things have I done wrong? So it's both aspects when it comes to reflection. So, and again, illustrating on the traditional learning methods, we're not doing the traditional learning anymore. So we've got all the simulation labs, extended realities, technologies, but when it comes to education, and especially demanding nursing education, we should make sure that we have correct techniques like reflections to make sure that our learners have a good experience in education. So just some important evidences to kind of back up my statuses. So reflection as a learning experience. Now, when we look at learning and experiences, we have a thought where we have to think about our thinking, which is called metacognition, and it sometimes doesn't always lead to learning our thinking. We have to make sure that we think and incorporate what we have learned. So there was a study where they did a study on expert chess players, and they found out that the person who wins, or the person who's called an expert, is who has learned from their experiences and who is able to recall all of those statistics and all those moves to make sure that the next move is going to be a right one. So even in nursing or in any of the healthcare professionals, you have to make sure that you have a good experience and a good knowledge so you know exactly what your next move is going to be, like the chess players. So just a quick illustration on novice to expert continuum, where some debates are there within reflections where nursing expertise they thought was developed through reflections. So because they thought that reflections were the things that create an expert, they thought teaching reflections to students will make them experts. But that's not the case. You have to have the skill acquisition and the reflective practice to come from being a novice to go to an expert. So it's a big continuum where you don't go from being a novice to an expert in one day, but you have a learning experience and you have a continuum of things that happens. So you have to be reflecting and reflecting to make sure that you come to that expert level. So learning reflective practice will not make you an expert, but will make the journey a bit easier for you to become an expert. So a quick slide on preceptorship. So just a life experience. So I'm sure all of you nurses have learned about putting a cannula. Just reflect back onto the first that you had to put an actual cannula on a patient. You have done it in the simulated labs, you have done it on several patient models, but on the actual patient, the first day that you inserted a cannula must have been traumatizing because you don't know if you're going to prick the right place, if you're going to bleed the person. So that incident, now flash back to like 5 years now that you're practicing now, you probably are doing it with your eyes closed. Right? So why did that become something that's very tacit? Because you have got that knowledge inside you. where reflections, where your learning, your theory, your practice has become incorporated in your knowledge. So that is tacit knowledge, where sometimes, like tying your shoelaces, you're not able to give it to someone else, but you have learned it over the years, and it has become something that is incorporated in your day-to-day life. So that is something that we as educators should think of when we create preceptors, because we could create some things like thinking aloud, so that our novice learners will have something to learn from our reflections, right? So if we go back to teaching, we have to make sure as teachers, we make sure that if we ask an expert supervisor to a novice person, a novice nurse comes and asks an expert supervisor, why did you do it? The expert nurse would not have a clue why they did it, because they have done it over and over again for so many years. So having good preceptors with reflective knowledge and thinking aloud might make it easier for our students to learn from the expert knowledge that we have got. So we've got different modes of reflection. One of the two other things that are very popular are reflection in action and reflection on action. So Sean and Dewar are kind of the pioneers of reflections in modern reflections, and they have become like the gods of reflection, if I might say. Now, moving on to the IIHS contribution to reflections, I think we have become the pioneers of nursing education, research, and reflections as well. So IIHS has created an augmented reflective practice where we create reflection day-to-day practice with a view to improve not only professional standards but a total healthcare system with the use of modern management concepts and techniques. So we use clinical and administrative information to make sure that we have a good cycle for people to reflect, or for student nurses to reflect. So we have transformed people, community, and the landscape through innovation, and this is one of the concepts or one of the models that we have created to make reflection easier and accessible to all our students. So just going through this model where the augmented Gibbs reflective cycle, it is kind of adapted from the Gibbs cycle, which is incorporating in with the learning strategies or the learning tools. And the first thing is about descriptions, where we have situation analysis, and it's more like in administrative work, it's more like the case study that we have. And we always have objective data within case studies or situation analysis that you describe the event that has happened. So if you have, now reflections happen with any surprise. It could be a happy event, or it could be a very sad event. So when it comes to reflections, you could be reflecting on something that has happened really well or something that might have gone wrong. So the description would be, you analyze the situation, you give objective data, you gather objective data. And feelings are very personal. It might be something that you have gone through, and it is very subjective in nature because we have all qualitative data. And the evaluation is kind of the most important things of learning here, where you identify the issues and you prioritize the issues that you have gone through. And analysis is you analyze the problem, where you create a cause and effect matrix. I'll go through these components. And conclusion is where you create a solution or a solution tree, and we've come about with the ECT matrix for this reflection, augmented reflection model. And with regards to the action plan, this is where you recommend what might be the next time that you come across these sort of things. And with regards to the administrative part of it, we create system developments with these recommendations and what you have identified. So just describing all of these stages, the first would be the description of the event. So you describe in detail the event that you're reflecting on, what happened, who was involved, why did it happen, when did it happen, how did it happen, right? And then the stage 2 is feelings. So you incorporate any feelings of the person, everyone who's involved, your personal feelings or anyone who's involved. And stage 3 is your evaluation, where you evaluate what has happened and you identify the problem. So in the identification of the problem, you look for a gap between what is expected. So that might be your nursing policies and guidelines and what actually happened in that case. So why did it happen the way it happened? So you create you identify the problem and you create the expected and the actual, or the what happened in that case. So exploring the gap, the problem, and then that's where we analyze the problem. And with regards to the problem analysis, it can be through system. That's the speciality with the augmented learning. So we have the system issues that we identify and then the personal issues that we identify. So both of these will be learning experiences for educators, students, and the hospital administrators. And the fourth one would be the analysis, where we include what went well and what sort of things were right and what sort of things. And that would be the way forward, where we analyze the problem. So here we would need a lot of literature, and where we create a problem or a root cause analysis. And then we move on to the conclusion, where we give solutions. So within the conclusion, we create something called the ECT matrix, where we prioritize the solution. So from the problem that you identified, from the gap that you identify, you create or you identify few solutions, and then you prioritize what these solutions might be, depending on the effect that it's going to make, the cost that it involves, and the time duration that it involves. So we prioritize these training or these needs or these identified solutions to our problem. And then we create an action plan, where these, the things that we identified within the ACT matrix, how we are going to be practically addressing these issues. So you are going to be explaining the solutions more descriptively here. And the second thing that at IIHS we do is we have reflection presentations by students. So this is for any students, nursing students, physiotherapy students, and biomedical students at IIHS. We have reflection sessions where students from their clinical placements or from their learning come and present. So that is something that we are really proud of. And over the years, we've started in 2011, and we've done over 2,000 reflection presentations at IIHS, which we are very, very proud of. And I'm an IIHS student, so I've done reflections myself as well. Those days it was not something that I was looking forward to, but I really know the value of it now. And the third point that we at IIHS have done is we have created a dedicated session at the annual research forum, where we publish our research reflections as well. And we've started it from last year, and we've got all of these reflections published in our journal. And the last thing that we have done at IIHS, or one of the last things for reflections we have done, is we've conducted research in different aspects of reflection. So we have done a few research, and some researches are underway, where we have looked at the use of reflections among healthcare professionals, reflection as a learning tool, and different approaches of reflecting, and perception reflections, which is a kind of a qualitative one, and teaching and learning engagement in reflections. So the last few slides, where reflections can be just a mirror image, but for nurses it's quite a different story, because you see right through your patient, and that's what reflection should do to you. Because once you have a clinical scenario, that might mean that you know what this clinical scenario portrays, and when you go home you have to reflect on what you have done so far, and what sort of things can you do to improve yourself and the patient quality, or the quality of the patient care. And my last slide, it's not going to be an easy, or it's not going to be a straight road, but rather a very complicated one within reflection or in learning. So you make your own path, and that's where reflection sits, where you make it personal to yourself. And these are my references. Thank you.